5 cases of brain trauma, mostly manifesting as psychological issues and disorders, which, well, it's very likely related to Trenbolone. I mean, the documented cases anecdotally and even in the scientific evidence regarding Trenbolone's terrible negative effects on your mood and your overall composure is extensive. Vigorous Steve here. I got a new Trenbolone study for you guys, fresh off the presses, a study which indexes all relevant human case reports where Trenbolone was a contributing factor to hospital admittance or even death. Yes, Trenbolone was being used when these subjects passed away. Now, was it the sole root cause, or did these patients pass away from a horrible bout of tren cough? There's only one way to find out. Let's dive into the study together and see if we still want to use Trenbolone after we're done reading, reviewing, and analyzing this study and painstakingly trying to come up with ways to justify further Trenbolone use going forward. This literature review was performed by Lucas Casiri Camara, Diogo Pinto da Costa Viana, and Lucio de Souza Monte Alto, who are all from Brazil. Fingers crossed I didn't butcher your guys' names. I tried my absolute best to pronounce these names correctly. This is like my 10th take already, but I have limited understanding of Portuguese. Desculpe. This study is titled Adverse Effects of Trenbolone, a Structured Review of Case Reports in Humans. It was published on March 14th, 2025, so that's a little bit over a month ago, and it was published in the World Journal of Pharmaceutical Science and Research. Let's dive into it. Here in the introduction, the researchers mentioned that Trenbolone is being used to improve feed efficiency in cattle, and due to its potent anabolic properties, increasing body weight and overall muscle mass in these animals, it quickly gained interest in the bodybuilding community, even though there's no regulatory agency which approved Trenbolone for human usage, and the human clinical trial data is extremely limited. Which isn't exactly true. Trenbolone hexahydrobenzocarbonate was actually approved for human medical treatments in France between the 1980s and 1979, after which it was voluntarily discontinued, likely due to heavy abuse by the bodybuilding community. And from France, Parabolan, which was the brand name, found its way all over the world and was rarely used in the bodybuilding community, as many of the IFB pros have documented in the early to late 1990s. It was produced by Laboratoires Necma, aka Necma Pharmaceuticals. Unfortunately, we only have the front page of the medical insert available. I was never able to find the back page of the medical insert, which might contain references or citations to human studies or human clinical trials. These were unfortunately never published, not to be found anywhere, but they might be sitting in a vault within Merck Animal Health USA, who owns the rights to Trenbolone acetate and still produces various veterinary Trenbolone products to this day. Anyway, I discuss all of this in the Trenbolone deep dive video. Give that one a watch if you haven't already. Further on in the introduction, the researchers mentioned that in the animal studies, there are clear observed adverse effects and toxicity concerns. Now, these toxicity concerns are mostly coming from the animals surrounding the cattle ranches where Trenbolone acetate is being administered to cattle, and then they basically pee out the Trenbolone or the Trenbolone metabolites. It's seeping into the groundwater, and thus all of the surrounding animals are polluted with Trenbolone or Trenbolone metabolites. And the adverse effects observed in animals are rarely reported, to be honest, from all of the studies that I read. And mostly these animal models look into feed efficiency. How much extra meat can this cow produce when we supplement a little bit of Trenbolone sandwich in for the same amount of food, right? They gain 25% more muscle by the addition of Trenbolone, and that's a lot more cost effective. Now, obviously, there are concerns from the lack of human clinical data or overall safety data in human subjects, and thus they aim to provide a comprehensive literature review of all of the human case reports to identify patterns of adverse effects and provide clinically relevant information for safer usage in patients. Then again, Trenbolone users and abusers are not patients. We don't use Trenbolone for medical conditions we don't suffer from. And Trenbolone users don't suffer from cachexia or states of undernutrition and are certainly not elderly. When you're old, you shouldn't be using Trenbolone. You should just relax on TRT only. Trenbolone we don't use following a major surgery. We use BPC 157, TB 500, GHK copper, growth hormone, Anavar, and collagen peptides, allegedly. Trenbolone we don't use to resolve extensive burns or bed sores. And when we are senile or we have glucocorticoid-induced osteoporosis, we don't use Trenbolone for that. And if we do use Trenbolone, most bodybuilders don't limit themselves to 76 milligrams per bolus, yielding 50 milligrams net Trenbolone per injection, done every 15 days to every month. All right, so the medical treatment dosages, which were at one point or another approved in France up until 1997, we completely forgo, and the dosages we take in most instances are far, 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 far higher. The researchers looked for applicable human case reports on PubMed, Embase, and Central using various keywords related to the Trenbolone sandwich. They aimed to obtain relevant information including patient gender, age, history of Trenbolone use, their medical history, and history of other drug use or abuse, the affected organs, laboratory findings, toxicology screening, and even organ imaging. So they were very thorough. I got to give them credit for that. That's not something I did for the Trenbolone deep dive because I felt that the Trenbolone case reports were a little bit all over the place and not exactly what I was aiming for the Trenbolone deep dive. So we got to give these guys some credit because they did all the work for us, and I'm just here analyzing their results. In the results of this study, the researchers indexed the adverse findings in Table 2. You see here that all patients were male. No surprise there. I mean, women shouldn't be using Trenbolone unless they compete in a bodybuilding competition, but we'll save that for a different discussion in a different video. 8 men were between 20 to 30 years old. 10 men were between 30 to 40 years old. 2 between 40 and 50 years old. And 2 were close to 60 years old. Imagine taking Trenbolone when you're 60 years old. Again, you should stick to TRT and TRT only when you're over 50, 55 years old, in my opinion. That's exactly what I'm going to do. So I got about 15 years left. To be fair, though, the adverse effects are kind of all over the place. They aren't very consistent. There's 6 instances of cardiovascular disease, half of which were determined posthumously after death. And as we all know, cardiovascular or heart disease, left ventricular hypertrophy, or heart failure doesn't happen overnight. That happens over a multitude of different years, not acutely as you're taking Trenbolone. So was Trenbolone a contributing factor? Very likely. But was it the sole root cause of cardiovascular disease, heart failure, or even death? Probably not. There were 5 instances of liver-related complications, most of which have reported polypharmacy, long-term steroid use or abuse in general, or the use of other ergogenic aids, as well as chronic alcohol consumption while using Trenbolone. Again, liver-related complications could be caused by a multitude of different factors, including lifestyle choices, right? When you're taking Trenbolone, you shouldn't be drinking alcohol, especially not chronically and insane high dosages. That's the ZIS way, that's the Gen Pop way. If you're a little bit older, take care of your health, take care of your liver, especially when you're using Trenbolone, because as you'll see from the study, Trenbolone might have a modifying effect on bile acid secretion. If you're not supplementing with TUDCA, then liver health obviously is going to take a turn for the worst, even though the animal models show that Trenbolone is somewhat liver safe. There were 3 instances of kidney injury, one of which was actually related to rhabdomyolysis. Kidney injury can be caused by chronic oxidative stress or chronically elevated blood pressure, just like chronically elevated blood pressure can have a negative effect on heart health in your cardiovascular system, which can occur with any kind of steroid. This is well documented with a couple different steroids, including nandrolone. And kidney injury in general is very well documented with boldenone, both in animal models and human subjects. I already made a deep dive describing the human subject and the animal models in a 2-parter deep dive. But these studies have not been reproduced in other steroids. So you might say that boldenone is absolutely deleterious and terrible for kidney health, but if these same studies, these same models have not been reproduced in the other steroids, then all you have to go with is case reports, and you might be able to say that boldenone is deleterious for your health and Trenbolone, due to the case reports, is also deleterious for your health. But if kidney injury has never been studied in mastestrone or primobolan or testosterone or the other steroids, that doesn't mean that those steroids are safe for your kidneys. Absence of evidence doesn't equal evidence of absence, right? Keep this in mind going forward. I don't think that any steroid is kidney safe if you don't manage your oxidative stress or your blood pressure. What is interesting though, and I'm sure some of you guys can relate to this to a certain extent, 5 cases of brain trauma, mostly manifesting as psychological issues and disorders, which, well, it's very likely related to Trenbolone. I mean, the documented cases anecdotally and even in the scientific evidence regarding Trenbolone's terrible negative effects on your mood and your overall composure is extensive. Let's be honest. And these case reports are basically the worst of the worst. What can happen while using Trenbolone? We'll dive into that a little bit more later on. And there are a few single case reports with a wide range of adverse effects, including acne, eye herpes, diabetes, injection depot complications resulting in necrosis, which is very likely related to some random underground lab that's completely unsterile or produced in synthetic carrier oil, literally dissolving the muscle from the inside or the bacteria eating away at the muscle from the inside. And Trenbolone, there's even one case report resulting in pancreatitis. Now, I think all of these case reports can be explained away. They aren't solely related to Trenbolone. Well, maybe the acne is. Don't read that case report. It's absolutely disgusting, brutal, graphic imagery. We're not going to show it to you guys, but the citations are all linked down below in case you want to get some snuff in for the day. And there are more case report findings indexed in table 3 and 4, but it's a little bit hard to interpret what the dosage patterns, the toxicology, the polypharmacy, and the patient health background for each commonly reported complication actually is. So I made it very easy for your dopamine depleted trend brain and grouped everything together. You're welcome.